You've probably heard of kidney stones and are familiar with it, but what about ureteral stones? Well, I haven't heard of that either, but we do have our go-to urologist, Dr. Salim Choonara, standing by to help us unpack what ureteral stones are, how they are diagnosed, and how they are treated. Assalamu alaikum wa rahmatullahi wa barakatuh, Dr. Choonara. Shukran for joining us once again.
Walaikum salam wa rahmatullahi and to your viewers and listeners as well. Thank you so much for having me.
Alhamdulillah. All right, now let's just get straight into it.
Statement about World Hijab Day. So I just want
Yes,
to say,
yes.
Alhamdulillah, we salute you and obviously all our sisters out there that wear the hijab with such pride and distinction, Alhamdulillah. And I'm so glad that you're highlighting this, with all the recent issues in Europe and France, etc. Good to talk about a topic like this, and we should go well, inshallah.
Yes, Alhamdulillah. Shukran for your comment there, because we would also like to get a male perspective on hijab, what hijab means to you. And if you have sisters, mothers, wives who wear hijab, etc., and, if they were facing challenges like the sisters in Europe, it's not something that you would feel proud of. It's not something that you would like to see them experiencing. So shukran for your comment there, doctor. Now let's get straight into our topic of discussion, ureteral stones. What exactly are they, and how are they different from kidney stones?
Okay. Yeah, I think it's a nice topic to distinguish, the location of the stone. So when we speak about urethral stones, we mean the tube that is between the kidney and the bladder, urethral. You also have something called urethra, uretra. That's a different tube. That's from the bladder to the exterior that allows you to empty your bladder. So just so that people don't get confused with the terminology. So ureteral means the tube between the kidney and the bladder. Now, it's not common that stones will usually form in the ureter. That's not a common situation. By far, the most common way in which a stone will end up in the ureter is that it forms in the kidney, and then once the stone reaches a certain size, or there are other factors that will cause the stone to sort of break away or be detached from the inner lining of the kidney. And obviously, if it's in the kidney lying loose and floating around, the way it's gonna find its way into the tube called the ureter, right? And when that stone gets into the ureter, that's often what makes individuals go to seek medical attention in the middle of the night or early parts of the morning, because that pain is an intense pain. And that's often what causes people to come to the casualty or the emergency department to seek treatment for that kind of acute pain, As compared to a stone that lies in the kidney, that stone can remain there, and it can grow and not necessarily trouble you all that much. It may give you a bit of pain, a little bit of discomfort, maybe a bit of infection, but not a severe acute pain. So also the presentation is also very different in terms of how a kidney stone will present and how a stone in the ureter will present. But the point here is that the one leads to the other. A stone will form in the kidney, eventually break off, and then either pass through the tube and come out completely, or it may block the tube that's the ureter between the kidney and the bladder.
All right, so you mentioned that it breaks down, so the sizes differ. So it would be a bigger one in the kidney, like the kidney stone would be bigger compared to the urethral.
Yeah. So what would happen, but and there's something that we don't fully understand what necessarily will cause a stone to detach. Because remember, a stone, even in the kidney, it doesn't just happen to be, let's say, 5 or 6 millimeters. At some point, it's microscopic, and with time, it crystallizes, and eventually grows and gets bigger in size. Now, you get stones in the kidney can vary from 2 millimeters to like 2 centimeters. It also depends on the location where they are. If they're in a very dependent part of the kidney, those stones could remain there and grow and just get bigger, with time. But the stones that are sort of in the upper part of the kidney, the middle part of the kidney, as they grow and get bigger, because of the weight and the size of the stone, they may detach. When that stone falls away from the kidney, it's like a funnel. It's gonna find its way into the ureter because that's the only way the urine can pass. So even the urine will almost move the stone towards the ureter. Now, if a stone is less than 4 millimeters, there's a good chance that stone could pass down the tube, come into the bladder, and the patient will pee it out. It may give you mild pain, a bit of discomfort, nothing too hectic. It can sometimes cause you problem if you get blocked, but the stone generally, for 4 millimeters and bigger, is likely to get stuck in the ureter. So it will be in the kidney, break away, go with the urine, get into the ureter, and at some point along that pathway, because remember that's a long tube, at least about 25, 26, 30 centimeters in some individuals. It's a long tube. That stone has got to make its way all the way down the tube and get to the bladder, and then you'll be fine. You can pass it out. But if that stone along is traveling down the tube, it gets blocked somewhere, it gets stuck somewhere. It's going to cause severe pain because what happens is that the urine is now going to flow from the kidney down to the bladder can't because it's almost like a plug, like a blockage in the tube, which is preventing the flow of the urine. And that can cause severe acute pain, which is, again, like I said, cause the individual to rush to the emergency department. So the size, obviously like a stone that's like a centimeter, for example, a big stone that's in the kidney, even if it breaks away and it's floating in the kidney, it's unlikely that stone is going to be able to get into that smaller tube. Because the ureter is a tinier tube, it's maybe at maximum probably about maybe 4 to 7 millimeters in diameter, maybe even less. So a very big stone will unlikely get into the tube. It could just maybe get to the top part of the tube and sit there and block the tube, but it won't really get inside that narrow pipe or narrow tube, for lack of a better word.
Mm-hmm. All right. Now, you spoke about the pain. What are the other symptoms besides the pain?
Okay. The other common symptoms with ureteric stones is nausea. Nausea. People don't necessarily vomit, but they feel very, very nauseous. So it will be a severe pain, and often patients describe it as pain that basically down along the side, traveling down towards the groin. In a male patient, they'll often say that the pain feels like it's going from the back, traveling to the front, going down towards the testicle. That's how a male patient can sometimes describe the pain. For the female, they would describe it again as flank pain or side pain, pain coming to the front, radiating down towards the groin area as well. So pain is very important, and nausea, and not only vomiting, but nausea. Those tend to be typical sort of features of a stone that's in the ureter. They can also have blood in the urine. Sometimes they can see the blood, and other times it might be visible to the naked eye, but only when we test the urine, we may find traces of blood in the urine. But predominantly, those are the more common acute symptoms that someone will have with a ureteric stone.
Mm-hmm. Okay, and how are they diagnosed?
Okay. So again, the pain almost gives it away. If somebody comes in and they're rising in pain, they can't stand properly, that pain is acute. I often make it a point of asking my female patients that have ureteric stones, which is worse, childbirth or stones. And I must say, almost all the patients say the stone pain is worse than childbirth. So that's a very interesting comparison. You know what I mean? So I think that's the closer that a male gets towards childbirth is if he has a ureteric stone. So the pain is very classical. I mean, severe onset of pain. You can't even stand properly. Nausea is a feature. And then obviously, as I said, when we test the urine, we may find blood in the urine. A very simple test we do in our rooms is an ultrasound, very freely available, non-invasive. An ultrasound, let's say, for example, there's a stone blocking the left kidney or there's a left in the left ureter. As I said to you, because the urine can't pass freely enough from the kidney down the tube or the ureter into the bladder because the stone is blocking it, what happens is that the urine starts tracking back up to the kidney, or it builds up in the kidney. You got an obstructed kidney with urine sort of building up in there. When we do the ultrasound, we can see what we call hydronephrosis, or which in very simple words mean swelling or distension of the kidney as a result of urine building up in there. It's often a very classical feature as well. And the gold standard for diagnosis of any stone still remains what we call a CT-KUB, or a non-contrast CT scan of the abdomen. That 95-96% of stones can be detected by means of a CT scan. The size, position, location, all of that can be clearly diagnosed. So those are generally the process we would follow in terms of making a diagnosis.
All right, Dr. Choonara, let us take a quick break. And when we come back, we'll talk about the treatments involved. Please stay with us.
Water well and borehole allows children to go back to school, empowers communities, and is a means of sadaqah jariyah. There are many villages in Africa and Afghanistan that are in need of water wells and boreholes. Sponsor a water well in Africa at 14,500 rands, or a borehole in Africa and Afghanistan at 49,500 rands. Call Africa Muslims Agency on 011 834 8685 or donate at Africa Muslims Agency.co.za. Africa Muslims Agency, inspiring the spirit of giving.
For a long time, we've lived in a centralized world where institutions held the all-important data and confirmed all transactions. Those times are over. Welcome to Libertas Group, a blockchain development company boasting an ecosystem that continually redefines the way we do business. Our blockchain is decentralized, making it immune to hacking or alteration, putting the power back in your hands with no middleman so you can focus on the growth of your business. Libertas, the simplest investment choice you'll make.
Shimmer, sparkle, captivate. Nothing less than a masterpiece. Droplets of gold inspires precious design. Platinum bursts with intricate freshness. And every pure diamond becomes more than just a girl's best friend. Voda Gold Gem Jewelers, where timeless dreams become a reality. Come to us. We tailor-make designer gold, platinum, and diamond jewelry. Trade in or remodel your old gold. Clad yourself with classy name-branded watches. We offer insurance valuation and free zakat calculation. Visit us at 534 Ridge Road, Overport, or call 031 208 9142. Voda Gold Gem Jewelers, manufacturers of fine gold and diamond jewelry.
Your act of love gives hope. Islamic Relief supports orphans and vulnerable children in 28 countries with food, education, and medical care. There are more than 150 million orphans in the world. You can give hope to one. Sponsor an orphan today. Go to www.islamic-relief.org.za.
Listen to something fresh. Listen to Salam Media, your humanitarian broadcaster.
11:18. You are listening to the Mid-Morning Talk on Salam Media with me, Mara Mukwanda, and we are talking ureteral stones. Well, it is something different from kidney stones for sure, but the stones that are formed in the kidney are usually broken down and passed to the ureter. Yes, is it uret? Yeah, it's not urethra, so it's ureter. Yeah, they're a bit confusing, but that's what we are discussing. And if you have any comments or questions, please leave them in the comments section, and Dr. Salim Choonara will be glad to give you some advice and answers regarding that. Dr. Choonara, shukran for staying on the line. Now, how are ureteral stones treated?
Okay. Now, there's an interesting difference between just the kidney and the ureter, right? As I explained earlier, the location, etc. We've kind of ran through it already. Structure. In other words, can you hear me, right?
Yes, now I can hear you.
There's an obstruction, basically, the kidney, so the urine can't pass freely from the kidney down to the bladder. So what we have to do in the initial situation is we've got to put in what they call a stent. Now, let me explain. Now, often when you say stent, people think about a cardiac stent or a stent in the heart, right? This is not a stent, like what they call a DJ stent or double J stent. Think of it like a drainage tube. It's got a long tube. It's got a curl at the top, curl at the bottom. It's at least about 26 to 27 centimeters in length. And you place this tube in such a way that the one part of the stent is in the bladder. The stent gets fed up the ureter into the kidney, obviously bypassing the stone that may be in the ureter. So the stent serves the following purpose. It allows us to drain the kidney via that stent. So it helps with the swelling. So the swelling of the kidney comes down, and that significantly helps with the pain. So the stone may still be there. For example, let's say a patient's got a 6 millimeter stone, for example, stuck in the ureter. it's causing a lot of inflammation of the ureter. Now, because for us to be able to get to the ureter, I mean, if you just think about how are we going to get our cameras or our instruments into that tiny little space without causing some damage to the tube. So that's why we put a stent first, right? And that stent stays for about 2 weeks. It allows the kidney to drain, all the inflammation settles down. And more importantly, the ureter we're talking about now, there's an interesting phenomenon that happens when we place a stent into the ureter. So initially the ureter is very closed off. It's like it's peristalsis, it's like a tube that pulses. As the urine passes, it opens and closes. So when a patient presents for the first time, that tube is in a closed position. By placing the stent in the tubes, in other words, the stent goes from the bladder up the tube into the kidney, we now allow the kidney to drain via the tube. But the other important benefit of the stent, it allows the ureter to relax. And so the ureter opens up, it gets wider. As a result of that, the stone that's stuck in there could fall out and it could come into the bladder and the patient could pass it out with the urine. But if that doesn't happen, by putting the stent in, we've now committed the patient to come back for a follow-up procedure, which usually is in about 14 days, let's say 2 to 3 weeks' time. Patient comes back again for a follow-up procedure. And the second procedure now, if you think of it now, initially the patient has swelling of the kidney, lots of inflammation, etc. By placing the stent, we've now allowed the kidney to drain, the swelling goes away, the inflammation settles down, the patient's pain has cleared up. If there was an infection, we managed to clear it out as well. At the second procedure now, we can get our camera into the patient's bladder. The ureter will be nicely opened up in a wide tube. We can easily get our instruments into the tube, go along the tube with our camera, identify the stone, use a laser, whatever we need to do, break it up. We have a special like a basket which we use to catch the stone and we can extract the stone. At the same time, while we're there, we also have the opportunity to advance our camera or advance a camera into the kidney now. Because remember, that patient, often it happens if somebody presents, for example, with severe pain, they got a ureteric stone. But as I said to you before, remember, these stones form in the kidney. It's very likely that they could have other stones that are still stuck in the kidney that may not have broken or detached and fell into the ureter, but they may still be in the kidney. So if we're going to go all the way to theatre and sort out the ureteric stone, we make sure that we have cleared up the kidney on that side, if it's the left or the right side, depending on which side the patient presented with. So at least we've completed our treatment and we've eradicated all potential stones that could give late and it could give problems down the line, So in summary, often a very ureteric stone often requires 2 procedures. The first procedure is just to put the stent in, unblock the kidney, let the inflammation settle down, bring you back again after 2 weeks when everything is cleared, settled, no more inflammation, ureter has widened nicely, camera in, get the stone out. If you can think of it like that.
Mm-hmm. All right, and there is no other treatments involved. You can't drink it away or flush it away.
No, you can. So as I said, for a bigger stone, like for a 6 to 7 millimeter stone, a stone under 4 millimeters, there's about an 85, maybe a 90% chance that one can pass that stone out with medical therapy. It won't happen in every single patient, because remember, the critical thing about passing a stone is determined by the width of the tube. Because remember, everybody's ureter is not the same, right? The diameter, the width of the tube will vary. If it's a tiny tube, it's a small build person, very tight, but they got a stricture, for example, the stone will get to a point where it will get stuck, it will not be able to go further, and then that gives you to do what I just mentioned to you earlier on. But certainly, if somebody comes in with a small stone, we do give them the option of what we call medical expulsive therapy, MET. We give them a series of different types of medication.
Oh, we lost sound there, Dr. Choonara.
Can you hear me now?
Yes, can you just please repeat what you just said there a few seconds ago?
Sorry, apologies for that. So what I'm saying is that when somebody comes with a small stone under 4 millimeters, you don't just simply take them to theatre and put in the stent. Depending on how they're doing, how their pain levels are, how's their kidney function, do they have infection, are they diabetic, do they have other issues. But let's say the patient is otherwise stable and we think they can have medical therapy, we can certainly do that. It's what is called medical expulsive therapy, MET. What that means is we give them a different combination of tablets or intravenous therapy to allow the urine to hopefully flush out that stone. And that can certainly be attempted, that does work in some patients. It does work.
All right. And is it prevented? Can ureteral stones be prevented?
Okay. So when we talk about prevention of stones, we don't just talk about ureteral or kidney. We apply that to stones in general because, as we understand, the main source of any kind of stone is the kidney itself. So our efforts are always aimed at that level, not just only about ureteral. And that would apply to everything from water intake. If we treated somebody for the stone, we would have the opportunity of having that stone so we can analyze it, and we can advise them about certain dietary factors. So water intake would be important. If we think there's a dietary component, maybe they may need to be adjusted, we can advise them, maybe get a dietitian involved to assist with that. And then there's other things like alkalinizing agents, certain tablets to control the calcium levels, certain tablets to control uric acid levels, and and there's so many other products that one sort of tends that can do. Many people would resort to some herbal or natural products to try and prevent stones. We would combine a whole series of different measures to prevent patients from making stones, right? And the reason why that is so is because it's not really one particular cause of a stone. Stones are multifactorial. Many things can cause stones. So we try and direct our attention and our intervention at different aspects of the individual's life: water, diet, medication, a whole series of things to try and hopefully prevent them from making a stone.
All right. Now, one of the questions that I forgot to ask actually was the age groups that kidney ureteral stones are most common amongst. Is it men and women, and what age groups?
Yeah. No, so it's not common amongst children. Children, they develop just kidney stones itself is obviously a problem, and they most probably have some underlying metabolic issue. But if you just look at the average male and female, it happens. I would say stones happen more commonly amongst females for some odd reason. But no, I mean, in practice, you see them across the board. I wouldn't say there's any specific age that will predispose you to developing a ureteric stone. No, because the process of how the stone will get into the ureter is it will form in the kidney, somehow detach and then fall into the ureter. That's a pure chance. That can happen to anybody. So there's no specific age that predisposes someone to a ureteric stone. Stones in general are common, and there are certain medical conditions, like for example diabetes, patients with gout, patients that are hypertensive on specific types of medication, patients with a family history, those that have underlying kidney disorders are more likely to develop stones. And as a result of having kidney stones, they would be at risk for developing a ureteric stone, because that's where the source of the stone comes from.
All right. So, well, that gives us a little bit more information regarding ureteral stones. Dr. Choonara, shukran so much for your time once again and for shedding light on ureteral stones. I mean, I would never have known what it is exactly. Shukran so much once again.
Jazakallah so much for having me, and all the best for the rest of the month as well. Thank you so much.
Likewise. Assalamu alaikum. Urologist Dr. Salim Choonara shedding light on ureteral stones, what it is, the symptoms, the diagnosis, and the treatments involved. And if you're experiencing severe pain, nausea, blood in your urine, etc., please go and get yourself checked out because you might just have ureteral stones, and you are likely to get it if you have a chronic disease. So please be on the lookout. And also, prevention is better than cure. Make sure that you keep a healthy diet, a healthy lifestyle, and exercise and drink lots of water. It is 11:30. You are listening to the Mid Morning Talk on Salam Media with me, Mari Mukwanda.